Hi there, it's Kathy Cates and Melissa Hines from the Institute for Pelvic Health.
And you're watching Demystifying the Pelvic Floor, weekly videos providing real and simplified pelvic floor education for real clinical situations. We've got you covered.
Today we'll be talking about recurrent UTI and how this affects the pelvic floor muscles.
What is a recurrent UTI exactly? So it's greater than 2 infections in 6 months or greater than 3 infections in 1 year. UTI recurrences are usually acute simple cystitis rather than a complicated UTI. Most recurrences are thought to represent reinfection rather than relapse. We all know the symptoms. We either treat empirically based on our patient's subjective symptoms or based off of our in-house UA, or if we wait for that urine culture, we treat. However, I'm guessing one thing that a lot of us haven't considered are the pelvic floor muscles.
Pelvic floor dysfunction can cause almost the same symptoms of a UTI, including urethral burning, urinary urgency frequency, bladder pain, pelvic pain, hypersensitivity at the introitus, abdominal discomfort. Usually the first bout of UTI causes inflammation within the urethra. This releases mast cells and histamine. The infection can cause or exacerbate pelvic floor dysfunction that persists after the infection has been resolved. So often patients are diagnosed with another UTI where the symptoms are present, but there's no bacteria that's detected. In many cases, this leads to round after round of perhaps unsuccessful treatment with antibiotic, when really the cause now is coming from the hypertonicity of the pelvic floor muscles and nerve irritation. Continuing to treat with antibiotics is not the most helpful if it's not in fact a UTI and actually pelvic floor dysfunction, because now the vaginal flora is compromised, which can lead to BV, yeast, and other issues, which then creates that more hypertonicity in the pelvic floor. So making sure that you've ruled out pelvic floor dysfunction when your patient comes into the clinic with another round of UTI-like symptoms and bacterial culture is negative. So before treating with another round of antibiotics, assess for tone, the ability for the patient to relax the pelvic floor muscles with diaphragmatic breathing. If it is pelvic floor dysfunction, treating with antibiotics won't be successful and it will cause more harm than good. So that's kind of the key takeaway here.
So we want to make sure to educate our patients about the importance of diaphragmatic breathing, because remember that every time that diaphragm descends, the pelvic floor muscles can soften. So especially for our patients with that recurrent UTI, softening, releasing the muscles of the pelvic floor are going to be so helpful. If your patient is having a hard time feeling the softening of the pelvic floor muscles, the releasing of the pelvic floor muscles when they take a diaphragmatic breath, you can actually have them just get down on the floor and take a wide-legged squat position with the feet on the wall. And then, so your knees are literally going to be wider than hip width distance apart. A good cue is to say like your knees in line with your armpits. That can be helpful. And putting your patient in that shape will allow them to feel that nice sort of dropping and releasing of the pelvic floor muscles. Another thing you can consider, and that research supports, is the use of D-mannose. It's a natural sugar, and it can be helpful for some women with recurrent UTI. That's because D-mannose may help to alter the balance of that host bacterial interaction, because D-mannose mimics host uroepithelial receptors, so it might actually crowd out the uropathogens which are causing the UTI. And just be sure to choose a brand with no additives.
And that's a wrap. Did you like this video? If so, hit like and subscribe. Please share with your colleagues and comment below to let us know your biggest challenges in providing care for your patients with recurrent UTI.
And subscribe to our email list at instituteforpelvichealth.com to get your free guide, 4 tips for managing your challenging pelvic exam. You'll also get access to our free weekly pelvic health content.
And be sure to find us on Instagram, Facebook, and LinkedIn, where we'll post more pelvic health tips. We're super excited to announce we're developing an online pelvic health course for nurse practitioners.
Our course will break down the pelvic floor so that you can confidently care for your patients with pelvic floor dysfunction. By simplifying the pelvic floor, we'll improve patient outcomes and your provider experience. Thanks for watching and spreading the word. Let's revolutionize pelvic health. We'll see you soon.